So if you're a patient that's recently been diagnosed with multiple myeloma, I think there are several messages I as a physician would want to give you. First of all, this is a disease where the treatments are improving dramatically. Secondly, it's very important that we get the disease under control very quickly. And so induction therapy is around getting your disease from an active state to a state where it is completely suppressed. For certain patients, a transplant is then something we use as a consolidation therapy. It's used when the disease is suppressed, and what it does is suppress the disease even further. I often use a boxing analogy that the transplant comes after you've been hit several times. The transplant is there to really deliver that knockout blow to the disease. We also hope that after the transplant, that ongoing lower level therapy, what we call maintenance, is going to keep your disease under control for a long period of time. And there is a big move for that to happen in the next 12 months.